The Kwazakhele Clinic in Nelson Mandela Bay has been forced to shut its doors, leaving hundreds of patients without access to essential health services. The closure comes after alarming reports of criminal activity targeting the facility. The Eastern Cape Health Department made the decision to close the clinic, citing safety concerns to staff and patients. However, local police are disputing these claims, saying the closure is part of an attempt, by a ward councillor to cause panic and disrupt services in the area. Sipha Kema reports.
The elderly and vulnerable have been left in the lurch, feeling dazed and confused as the sudden closure is particularly hard for them. They can't afford transport to other clinics, and walking long distances is out of the question, as some use walking sticks and crutches to get by.
Ayikho enye iklinikhi onoya kuyo?
Ikhona.
Indawuni?
Ngezantsi.
The Department of Health says the closure was a precautionary measure after clinic staff were warned about criminal threats.
The Eastern Cape Department of Health would like to announce the temporary closure of a clinic in Nelson Mandela Bay over safety concerns. The Kwazakhele Clinic is not operational after community members informed healthcare workers about possible criminality targeting the facility yesterday. People that usually get primary healthcare services from Kwazakhele Clinic are receiving services at nearby facilities. The department condemned the targeting of healthcare facilities and workers with the contempt it deserves. We would also like to thank the community for alerting healthcare workers of the possible crime. This has saved the workers from potential harm and trauma. The department will assess the situation with law enforcement agencies before the clinic is reopened again.
The community is frustrated. They are pleading with the government to ensure safety, even calling for soldiers or a stronger police presence.
Akunawudeploywa na nokuba ngaba ngamajoni non-operator abakanye babesenza eyona action right kuzokwazi uba kubekho le solution yenzekayo ngakumbi apha Kwazakhele. Siyacela uba kungenziwa njani na, sicela kurhulumente akasideployele abantu abazothini kuba asinakwazi usuka apha siye kwezinye ikliniki sihamba ngenduku yasibona mbosnyako mapha nawe ngwanixelela uba mandiye ngapha ngaseday ngoku mna ndihlala ngapha simathongi ngapha simalandlandlandla.
The police, however, deny the clinic was closed due to safety concerns. They blame the ward councillor for spreading panic and attempting to instigate a shutdown.
I want to reject with the contempt it deserves. In fact, what this ward councillor is doing is very dangerous because he's mobilizing the community to go into panic. What I was informed, this person mentioned in the meeting that they are intending to do a shutdown in Nelson Mandela Bay. And if you do a shutdown, why closing the schools? Why do you shut down a clinic? A clinic during this time, it is bad.
But the accused councillor Gama Makula denies any involvement, saying the clinic was shut down due to safety concerns raised by the staffs themselves.
The clinic, I'm not part of the closure of the clinic. Let me make that clear firstly. And secondly, I received a message that was sent to me by the head of the clinic telling me that on that particular day, there was a guy who demanded a protection fee, and therefore they are fearing for their lives.
As blame shifts between local authorities, the community is caught in the middle, while denied their basic right to health care. The Kwazakhele Clinic remains closed, and for many, access to vital services feels out of reach. For Newzroom Afrika on Channel 405, I'm Sipha Kema in Kwazakhele, Gqeberha.